In terms of behavior, of your question of behavior, I think that is outside of the health care reform bill. That is something that we need to stress to people, to one, to take insurance and then to act on that insurance. So that's a behavioral pattern that we have to get people to go ahead and go to the doctor when they're sick and not wait till the very, very end.
And one of the things I read in preparing said that, speaking of behavior, that there are plans like the CHIP and these other plans that people aren't even enrolled. In fact, great amounts of people who qualify for these programs, I don't know if they don't know they're there or they don't, it's too much paperwork. I just saw that in one of the reports.
Yeah, Tony, I want to come back to something Alina said and just second that. You know, we in the South, and I'm from Mississippi, in many southern states view Medicaid and CHIP as a liability, not an asset. It's an asset for people. It's an asset for the state. It's an asset for health care. And I think what we have to do is make the case here and in Tallahassee that if health reform comes down the pike, that we want to implement it. We want to expand Medicaid. We want to expand CHIP. Medicaid and CHIP, we bring in more federal money than we spend from the state standpoint. It's a great buy, but yet many times we do not take full advantage of that. And one of the things that has to happen is we can have a gazillion people who are eligible for Medicaid, but if Tallahassee has rules that prevent people from being able to sign up and makes it difficult for them to get on and to stay on, then we haven't done anything. So one of the things that has to happen is our local politicians have to voice in Tallahassee that we need to make this program user-friendly. This program has to be something that is not a bunch of hurdles for people to get on. And I think part of it is that they may not know about it. But in most places, it's the fact that this program, most programs are very difficult. There's a lot of red tape. It doesn't have to be that way.
And as far as before the show ends, we have to mention the numbers I saw as far as if the public option stays in the Senate plan and we see that come out, or some type of public option, $2 billion just to start it up. If I'm a taxpayer, we all know the economy is better, but still not what it used to be, and I'm struggling, and I hear a number like $2 billion. As all three of you have spent your life in public health, how should we convince Americans that that's a worthwhile cause to fund?
Well, we're spending $1 trillion now.
Exactly. Look at what we're spending now, and we're getting nothing, and it's going to continue to spend. So yes, we need to invest in health care, just as a business model, and that's something that has not been done in this country.
You know, I was elected to the Connecticut State Legislature over 30 years ago and was assigned to the Health Committee. And at that point, we were shocked to learn that 7% of our gross domestic product was going into health. That's more than doubled now. If we could get back to 7% or even 10% or 11%, that would be great. This really has been sucking the wind out of us for the last generation, this healthcare problem. And it is about time that our country took dramatic action to try to really take this thing under control, because if we don't, it's not just future generations that won't be able to make it, it's our generation that won't be able to make it.
And do you have it, I know you're all watching it, and everyone has their own opinion, but do you have a hope of how quickly we might see something out of the Senate and then obviously to the conferees and eventually to the whole floor? I know, Dr. Fox, your hope is sooner the better.
Well, I don't think anybody knows. I would hope before they go home for recess, which may be stretching it a little bit, because I think if they go home for recess, it becomes even more problematic when they come back, certainly by the end of the year.
Dr. Alonso, do you have any?
I don't know how these guys think.
I would try to figure it out for a long time.
It needs to happen. The sooner the better. The waiting around is not good for anybody.
And they need to stay on the job until they get it done. I mean, I don't know how long it will take either. I don't know when they'll do it. But the time for vacation is over. I mean, it really is important. They stay on the job, get this thing done, and then come home.
Any fears that after all is said and done, nothing may really change?
Well, I think my biggest fear is doing nothing is not an option. That is not an option. We have to do something, and I think anything that expands coverage will be a start.
And as far as, and I know you mentioned this a while ago, but I want to reiterate what I read is the seniors in our area, they're very concerned because of wrong facts that have gotten out there, or just the whole fact that it's 1,000 pages and they don't know what's going on. With the plan that I saw, the House plan come out, it would not take away any kind of backup benefits that currently are in place.
I think that's true. It does affect some of the Medicare Advantage, but I think it'll expand drug coverage. It'll eliminate co-payments for preventive care, and I think in general it's not going to harm seniors.
And so those that are kind of getting a bit worried should go where to get the real facts? Because that's one thing I found in trying to brief myself on this. How do you judge what's coming out that could actually be a fact and not a spun fear tactic?
The Kaiser Family Foundation has a website that I think is great. It can be a little bit complicated, but they update it weekly. It has comparisons of the different bills, and it's a great website to go to.
And Dr. Alonso, you do you have, I know you said Tallahassee updates you regularly, but will you at any time be up there kind of getting briefed once it's all said and done, so you know what to do here in Palm Beach County?
No, they send the information down through us. We have weekly conference calls that we talk during those times. We have teleconferencing, and so they'll bring the message down through all the 67 counties.
And Paul, regardless of what happens in Congress, the FQHCs are already on their way to being reality with the funds from the Quantum Initiative. When may we see an actual new, I know we saw Found Care last week, but a new FQHC in Palm Beach County?
Well, I'm looking forward to going to see the new Riviera Beach clinic that should be opened around the springtime that Dr. Alonso and her staff are putting together, and that's going to be very important, and that may be the next one that actually opens its doors to provide care to people and care to patients. But I also wanted to just echo one other thing that Dr. Fox had said, and that is that really this is one of those times when doing nothing is not an option. The fact of the matter is, if the Congress does nothing, things will get worse. We're not in a position where we can kind of hold things where they are today. So the choice is things get worse or things could stay the same or get a little bit better. But we've got to act. We've got to act. And
not be fearful of some of the information that's coming out that's not necessarily on target.
Yeah, there's been a tremendous amount of misinformation. I think the death panels, some of the other things that have been put out there are totally erroneous. And I think in general, there are a lot of corporate interests that benefit by keeping things the way they are, and we just can't allow that.
Well, thank you all three for joining us. We could certainly go on and on, but you've given us some great information to start from. We will be watching what comes out. Thank you all. And if you want more information on what we've talked about or some of the programs we highlighted last week, go onto our website, wxel.org. You will find the information to sign up for the Healthcare District Insurance Plan and some of the FQHCs that are up and running. Thank you for joining us. We'll see you again next time. Good night.